Hey everyone, and welcome. So today we're going to tackle a topic that's often wrapped up in a lot of confusion, thought disorders. Our goal here is to really clear things up, to demystify terms like psychosis and schizophrenia, and break down what they actually mean. So let's dive right in.
Let's just start with this question, right? What actually happens when the one thing you rely on to navigate the world, your own mind, starts to feel unreliable? It's a really powerful and deeply human question, and it gets right to the heart of what we're talking about today.
Okay, so first up, let's decode psychosis. You've probably heard this word thrown around a lot, but what does it really mean? Truly understanding this term is the key because psychosis is the core experience that connects a lot of the conditions we're going to discuss.
So how common is this really? I think this number is going to surprise you. According to the National Institute of Mental Health, about 3% of people in the US will experience psychosis at some point in their lives. I mean, think about that. That's roughly one person in every 33. It's way, way more widespread than most of us realize.
And this right here, this is probably the single most important thing to get. Psychosis is not an illness in itself. It's a symptom complex. Basically, a collection of symptoms where someone loses contact with reality. This distinction is so important because it separates the experience from the person's identity. It's something someone goes through, not who they are.
So what does psychosis look like? Well, it usually breaks down into two main things: hallucinations and delusions. Hallucinations are when your senses play tricks on you. You might hear voices or see things that aren't actually there. Delusions, on the other hand, are all about beliefs. They're strong, fixed beliefs that just don't change, even when there's proof they aren't true. So a simple way to remember it is hallucinations are about your senses, delusions are about your beliefs.
Right. So if psychosis is a symptom, the next logical question is, what causes it? And this leads us to a really critical distinction between two conditions that often get mixed up: delirium and schizophrenia. And getting this next part right is, well, it's absolutely crucial.
All right, first up, we've got delirium. Think of this as a temporary state of confusion that comes on pretty suddenly. And the key word here is physical. It's triggered by something physical in the body, maybe a bad infection or dehydration or even a side effect from a medication. You treat that underlying physical problem, and the delirium, it usually goes away.
Now, on the flip side, you have schizophrenia. This isn't temporary. It's a serious, long-term mental illness, a chronic brain disorder. It impacts how a person thinks, feels, and acts over a much longer stretch of time. In fact, for a diagnosis, the signs have to be there for at least 6 months straight.
And this table just lays it all out so clearly. It's a perfect side-by-side. Just look at the difference. Delirium, boom, sudden onset, a clear physical cause, and it's temporary. Schizophrenia, it's a much more gradual onset. It has a complex mix of causes like genetics and environment, and it's long-term. Honestly, if you take one thing away from this explainer, this distinction is probably it.
Okay, so with that distinction made, let's dive a little deeper into schizophrenia itself. Because the way we see it in movies or on TV, it's usually pretty one-dimensional. The reality is that the symptoms fall into 3 really different categories, which gives us a much clearer picture of what the experience is like.
First, you've got what are called positive symptoms. Now, this can be a little confusing. Positive here doesn't mean good. Think of it more like in math, like adding something. These are experiences that are added to a person's reality. This is where you see the psychosis symptoms we talked about: hallucinations, delusions, that kind of thing. They are an excess or a distortion of what's normally there.
And then you've got the negative symptoms. And you guessed it, if positive meant adding something, negative means taking something away. This is about the absence of typical behaviors. It might look like a real loss of motivation, or pulling back from friends and family, or just not showing much emotion. These are things that get taken away from a person's day-to-day experience.
And lastly, there are the cognitive symptoms. These might be less obvious from the outside, but they can be just as challenging. We're talking about trouble with focus, problems with memory, or just a hard time organizing thoughts. These can really interfere with daily life and just having a conversation.
So, okay, after talking about all these challenges, it is so important that we focus on the most important part of this whole story: recovery. The way we approach treatment now is incredibly hopeful, and it stresses that living a full, meaningful life is absolutely the goal.
I mean, this quote really says everything, doesn't it? With the right diagnosis and treatment early on, recovery is not just a hope, it's a real possibility. And just let this part sink in for a second. Many people who get that early support may never have another psychotic episode. That's huge. It's why getting help fast is such a game changer.
So, what does that path to recovery actually involve? Well, it's not just one thing. It's a whole person approach. Of course, it starts with getting the right diagnosis. From there, it's usually a combination of medication and therapy. But it doesn't end there. It also includes things like skills training to help with daily life and, so critically, strong support from family and the community. It's really a roadmap for overall wellness.
And that really brings us to our final and maybe most important point. We know these conditions can be treated. We know that recovery is the goal. So that means one of the biggest hurdles left is stigma. So I want to leave you with this question to think about. How can we, in our own lives, in our own conversations, start to replace that stigma with real, meaningful support for everyone on the path to mental wellness?